Jai, welcome to our subsequent session of interaction with Athelo. Welcome, Athelo.
Hello, sir. It's great to be back.
Do you remember when did you join MBBS college?
I think it was 12th of January 2021. Although we were the 2020 batch, our MBBS started quite late because of COVID. It started in 2021.
For the first time when you stepped in medical college, what was your expectation and what was the real experience after joining?
Sir, I think to this question, my answer would differ from most of the other people you have interviewed because I was from the first batch and we didn't really have a campus. So everything I dreamed of, like it being a names and all, that is what it is now, I think. Because when I joined, we didn't have a campus. We had a temporary campus near GMCH and we had our classes there only. We had our practicals in GMCH. So yeah, it was quite a it was like a coaching institute, I would say, in first year because we had to go. We couldn't come back to our hostels or anything. It was in a far off place, so we had to go by bus, and we had to come back by bus. We used to reach our hostel by 6:30.
So, after seeing all these things, wasn't there any uncertainty, scarcity, or any nervousness, unsure about your future?
Yes, I think most of us thought that we would not get that much clinical exposure. And I think most of it creeped up in second year also because second year we did shift to the new campus, but our OPD wasn't functional yet. So yes, we were taken to different hospitals nearby to get that exposure. But we always felt lacking because I think what we should have learned in second year, we got that exposure in third and fourth year. It was a bit late, but I think we tried to catch up as much as we could.
Where were your classes being conducted?
So in first year, we didn't have this campus, so our classes were being conducted in a temporary campus near the JMCH Medical College at the hilltop. There was a temporary campus. We had a classroom. It was big enough, and we had a few rooms for the faculty. We had a dining hall where we could eat, and we had, I think, one demo room. And so that was it. We had our classes there, and we had our practicals in GMCH.
As a general trend, every doctor or medical student remember his or her first medical day. Usually, it is anatomy dissection hall. What's your experience?
Yes, I remember all my friends, we were quite excited to go there and to see the cadaver, to experience that for the first time. And we were taken to the GMCH dissection hall. We were fortunate enough to get a cadaver because usually batches get a lot of cadavers, but we only got one. And so, like the first day, I remember one of the guys fainting, and and the smell of formalin tormenting us. But yes, I think it was quite a new and exciting thing for us, and I think all of us got more interested day by day, and yes, we tried to learn as much as we could.
So you have dual experience while you were attending your classes in GMC. Later on, when your campus was completed, construction was completed. So then the classes were being conducted here in Ames campus, I believe.
Yes.
So this dual experience, what was your daily routine while you used to go to GMC, and later on when the hospital construction was conducted, what was your daily routine?
So uh, in our first year when we were going to GMCH, so our routine started well. The big difference was that we had to go, our hostel was all the way in Shantipur, so we had to go by bus early in the morning, around 7 to reach at 8 there. So we had to wake up very early, and thereafter we could not come back to our hostel or anything. We had to sit in the class itself. We couldn't go anywhere because there was not a campus to begin with, and our classes ended at 4:45. We reached by 6. But the thing which changed here was hostels were nearby, so we could go and come as we please. We could skip few lectures. In first year, it was like if we had to skip, we had to skip the whole day. So here we could like move around, jiggle around, and like use that 25% gap that we were given. that was 75% compulsory attendance. And so yes, our difference was I think the classes ended earlier than that. I think it ended at 4. So we got 45 minutes, I think.
Some pretty experiences from your first year days.
So first year, so I remember going to. So I think although it was something which was a hardship, I think we remember that going to the college by bus, everybody talking, and I think that was a part, and I think that helped us shift from our school day, and it was like our school days to begin with, and I think that is what helped us become friends, our new batch, because we didn't have anybody else in the campus. It was just us and the faculty. So I think, yes, I think the hardships are what brought us together. And I think it is said from nothing brings people together more than trauma.
What about your second year?
Yes, the second year was quite different. We had our clinical postings, but initially we were taken to nearby hospitals like Railway Hospital and Tolaram Bafna. We were taken there for our postings. And few times we actually even had theoretical uh, postings. So like teacher would come and they would teach us through boards and all because we didn't have patience. But I think by the end of our second year, I think our OPD started and our Ayush. So we got to see few patients. And by third year, it was I think full fledged. So we got to we tried to make up as much as we could.
What about pre-final MBBS?
Pre-final. So in our third year, and I think it was, I think rightly second year and third year have been called the honeymoon phase of MBBS because we get a lot of time and as second year is 1.5 years long, I think we get that time to do other things, to experience that college life, which I think isn't that much of a possibility in first and final years because the schedule is quite tight. And I think second and third year I got to enjoy with my friends, made a lot of memories. And one thing I remember is going to Pulse in Ames, Delhi. I think most of our batch, like almost 30 people went there. We were there for 11 days. And I think it was post COVID. So they celebrated it in a bigger way. So I think that was one of our core memories that most of us shared together as a group.
And lastly, what about your final MBBS?
So, final MBBS, I would say it was quite a difficult journey because I think, as everyone knows, the final year is quite voluminous and it's never ending, and so many big subjects and so much to cover and so less time. And with postings, and we had even to make up our attendance. We had postings or we had classes even after the stipulated time, so we had to go in the evening also. So it was hard managing at first, but later we learned to live with it. And I think the time before the exam was the most difficult. And I remember me and my friends having palpitations and sleepless nights. But at the end, it was over, and I think we all did good.
Palpitations and sleepless nights just before exam or because of classes?
No, sir, it was just before the exams, like during the exams while they were going on.
Okay. So this 4.5 year long period or journey, were you alone or were you able to make fast friends?
Yes, I think I started off having, I think in first year, everybody is your friend, it seems like. But over time, I learned who the close ones were. I stayed true to my circle. And yes, I can say that I've got great friends here with whom I've had lots of fun and had lots of new experiences and shared everything together.
In 4.5 years, which subject was the scariest?
So for me, it would have to be, I think, general surgery because because of because in other subjects it was like pretty clear. Like in medicine, I could integrate from what I had learned from before, but surgery, everything was new. The steps and all of surgeries which I had not seen, the cases I had not seen, so it was a bit difficult to catch up. And I don't know why, but I had a fear for it. And the palpitations I was talking about, it came, and the sleepless nights mostly came before surgery.
And which was your favorite one, or you used to like it most amongst all subjects?
So I think Atho in second year, and so I would say medicine and ops gynae in fourth year. I mean, they were fun to study because it was. I thought these were logical things, and I don't like mugging up a lot of things. And I think while I studied ops gynae and all, there were clear things. There were clear things that you did in certain like this clinical situation, or there were clear guidelines. There were clear things to do. Not much room to like twist things. In medicine, I liked it because it's an amalgamation of everything that I had learned from first year, and uh, I think patho was good because like so I liked reading that Red Robins.
Which subject or branch of medicine first caught your interest and forced you to learn it more?
So if you had asked me throughout my MBBS which branch I would take, my answer would have been dermatology, and mostly because I wanted a chill lifestyle. I still do, and but so now as I'm learning different branches, I'm getting the first-hand experience in my internship. So I think every day it changes, and I'm not sure. I have more options in my mind, but I think we'll see which one I end up taking.
You had no seniors that way, but there might be some mentors, teachers, professors, or for that matter, incidents which might have inspired you or guided you.
I think the one key difference is that for our juniors, it's easier to approach us than any faculty. But during our time, since we only had faculties, it was easier for us to approach them. And I think that acquaintance was made quite early on, and that's why most of the faculty know people of our batches, and it was easier for us to communicate with them directly. It was not that if we wanted something, we would go through our seniors to them. We would just directly ask them, and I think they also knew that we didn't have any seniors, so they tried their best to guide us. And in first year, we also had our mentor-mentee program. Each of us were assigned a particular teacher, and like weekly or monthly, we used to discuss our problems that we face or like whatever. And I think that way we were listened to.
What was that thing which changed your mind for this medical profession, and how was it changed?
I believe that medical professionals everywhere, especially in India, especially the residents, are quite overworked. What I had dreamed of was that medicine was a branch which was untouchable and lucrative and very high up, very highly regarded. But as I've seen now, it has become like more than it has become a service, a career oriented thing. And I think people, because people are more educated, they demand a certain level of medical care. So it's not like they will highly regard you as they did. They still respect you, but I think you are held more accountable. And I think that, yes, sir, that is one thing. And yes, as I said, the residents are quite overworked. And that is what scares me the most, I think, because I feel that the way the work should be distributed, it's not done in most of the colleges in India. And I think all of us come across those news and articles about residents leaving their field and even committing suicide or changing their branch, leaving the college, all because of this.
So, what message would you like to give for candidates or medicos who are facing such situation or circumstances?
So I think the most important thing is to talk openly about these problems, and I think the trend is changing. Previously, I don't know the juniors because of the fear or because of OT exclusion or exclusion from the department, they didn't used to speak up. But now, as more and more people are speaking up, I think that is the most important step towards change, and I think that is what uh, requires to be done. And only thing I would say to them is like if you're feeling something, speak up, speak your truth, don't be fearful. And at the end, you apart from you can only impart health to others when you maintain your own health, be it physical and mental. So I think you focusing your own health is also important during your MBBS and residency years.
What was the biggest challenge while you were undergoing that medical training?
So biggest
What
challenge for me would be, sir, that feeling that we are not getting enough clinical exposure, being it a new aims and so yes, sir. Because of that, I think most of us were quite skeptical about how it would turn up. But I think it turned out okay, even if we are not the best. But I think we have been taught adequate. I think we have done enough to know the basic things and to build from here on.
Probably you were the luckiest one who mm, had an opportunity to participate in cultural or annual functions of AIMS New Delhi, like Pulse. You might have been participating in regular sports activities, other extracurricular activities in AIMS, since then your batch is the first batch. So, do you think that your personality has been changed because of all this?
I think, as I said, I was under a social bubble. I had only few people around me, and I think AIMS being an all India institute, you get to meet a lot of people from all the parts of India. So I think it helps you grow and it helps you to, you know, talk and work together with people who may not be like-minded as you, too, but that is how you grow. And I think as a person, learn to communicate and work as a team. Most importantly,
Teamwork is the most important. I agree with. When did you appear your final MBBS exam?
March, February, March of this year.
This year. Okay.
Yes,
So that's uh, 7 or 8 months of your internship. Are
yes,
you
6 months to be exact.
six
I
months
think
of
6 or
internship?
7 months. Yeah, 7 months.
So in last 7 months of clinical posting, were there any patients experience which touched you the most and taught you something which you will never forget?
Yes, sir. I think my first posting was in medicine, so um, I think, sir, it was uh, like somewhere because I went first day, and the first day only I got to do cannulation, pleural tapping, and a lot of things. So it was quite a big thing for me. And I think in medicine I learned a lot. I learned to do a lot of procedures, and I think that's when I first, um, had my experience with a patient who was on his deathbed, and we were all trying to revive them. We couldn't at the end, but that's when what made me realize what that few golden minutes of intervention could do to a person, and how they are so important, how teamwork is so important, and how even I, someone who has just in the beginning steps, could help, could play my part in you know trying to save someone. And like, it was what everybody comes to medical profession, I think, to save lives. So I think that experience was what made me um, enlightened me and the most.
Fine. How did meeting and treating patients change your way of understanding after joining MBBS? That kindness, pain, and humanity.
I think the most important thing to have a quality to have as a doctor is empathy, to understand your patient's pain, not to underplay them, not to downplay them, and to treat the patient, not the symptoms. Because in the end, if you make your patient happy, if you treat your patient well, that if you give time to your patient, I think that's the most important thing to them. Because medicines are, I believe medicines work, but I think that if you give them that belief that they are going to be okay, that you're treating them, you're seeing them well, I think that's what gives them the strength to fight through their illness.
In what ways has life in medical college changed the way to you look at a patient, people, health, and society as a whole?
I think it has changed a lot of views that I used to hold, and I think for the better. I've changed a few habits of my own. I've tried to stay healthy, and I've learned the importance of eating healthy, physical activity, and everything. And the most important, I think, mental health. which people were ignoring. But I've seen that, yeah, more and more people are talking about it. People are coming for help. And I think, yes, sir, that has been the most uh, important part, inculcating all these things into my own life and trying to
And
stay healthy.
what about the people, society?
Yes, sir, I think the people, society, we in community medicine also we learned how important those awareness campaigns are, because most of the people aren't aware of these diseases. They have myths, they have confusions, and like in my rural postings, most of the people, even if they have a big illness or something, they have something grave diagnosis of something, they will just come for BP measurement or something. They'll be happy by a normal saline just for that. So I think because people are unaware of their own diagnosis, I think people need to be made aware of them. So I think people as a community together, our conceptions about health and diseases are changing. And I think it's down to those awareness problems and media. I think social media that has played a great role in changing the perceptions.
You being an intern, uh, how do you uh, dress while going for assessing a patient, whether may it be in OPD or in ward?
I try to go into my postings in my either formal dress or in my scrubs if I'm in a surgical branch or if I have emergency duty because I might be called into OT and all. And it's more comfortable that way. But yeah, I try to dress like a doctor. I try to look like a doctor so that the patient also treats and thinks of me like a doctor.
Is there any specific reason behind doctors or medics try to maintain or keep their outfit very formal?
Yes, so I think it builds an image in the people come to the doctors with an image in their mind. And I think it's important to uphold that, to look like one, to look like someone who could treat them. And I think being in a formal dress, well clothed, well groomed, I think to look like a doctor so that the patient also, but just by looking at you, he gets that belief that you are going to treat him, that
So
you are someone capable.
you mean to say that the Western countries or Western community who 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 say that this is my life, I can live the way I want. Are they wrong? Can't I I can't wear rag jeans while and assess patient?
So I think you can do whatever you want. That is a different philosophy. But like if you go that way, I think you are only harming yourself because you are going to drive your patients away.
Okay, so if had someone to be a doctor, then he should be mentally prepared that I have to wear formals. Am I right?
Yes, sir. So not like just formals. He should be well dressed. He should be presentable in a manner that the person thinks of him like a doctor. It shouldn't be like someone comes in and thinks of him like an attendant. Then if the person you are treating doesn't think of you as a doctor, no matter what you do, no matter what you treat, he's not going to follow it.
So how many days of internship have you completed?
So I'm done with halfway of my internship, and currently 5 months or 6 months are left.
So what did your internship year teach you about handling responsibility, working independently, and decision making?
Yes, I think the first thing that you said, responsibility, is what comes to mind, because like we can't skip it like our classes. We have to go and we have to be there on time. And I think it has taught us that the difference that our our formative years and these, I would say, performative years um, have. And I think dealing with patients day to day, I think doing a lot of written work as well, but we get to do our interventions, we get to do see patients firsthand. And I think that transition that makes you turns you from a student and to a doctor. I think internship period is very vital. You get to learn a lot of things. You get to learn how hospitals work, I think. And yeah, without it, I think PG, our PGs, and residency, we would have been lost.
Within 5 or 6 months, you will be completing with your internship and starting your future as a new doctor. From me and our viewers, best wishes for your future. Till then,
Thank you, sir.
Jai Hind.